Dr. Jayadevan, let me come to you first. Is it your belief that these fumes are carcinogenic?
If you search the medical literature, yes, fumes are carcinogenic. Fumes generated by the public burning of plastic waste. Yes, it's documented that they are carcinogenic. As to how severe the risk is, opinion is divided. It can range from extremely rare to rare. Now, what we are seeing here on the ground is basically mostly outpatient issues that can be sorted out in the clinic itself. There is a little bit of headache, burning of the eyes, cough. Some people get shortness of breath. Some people get nausea. And then people with pre-existing lung conditions, in other words, people with asthma and other lung conditions like COPD, a few of them have come and got admitted to the hospital. Overall, the immediate health concerns do not seem to be much so far. But as you said, the long-term consequences, it's difficult to predict.
You know, Dr. Jayadevan, the reason I ask is because when plastic is burned, now I'm quoting the IMA District President, Dr. Srinivas Kamath, who says that when plastic is burned, it releases toxic gas like dioxins, furans, and polychronated biphenyls. I looked up polychronated biphenyls, and these are extremely carcinogenic.
That's true. As I said, in the medical literature, they are carcinogenic, but the extent of the disease or the probability of the disease depends on the duration of exposure and also the dose of exposure. For someone who has had prolonged inhalation of these products over a long period of time, is at greater risk than someone who's located perhaps far away and is inhaling these products a little less. It is true. It is true that these are carcinogenic.
C.R. Nilakandan, what exactly is it that we are looking at? Yes, it's an environmental mess, but is this not an out-and-out case of people potentially being poisoned?
What we can consumption activity on the
old fire department.
Typical, we always.
Most of the authority.
Dr. Jayadevan, is it not a fact? What one agency versus the other agency? Sir, let's just face it. I understand, Mr. Dhanuraj, and I don't mean to be interrupting like this, but the horse has bolted now. What one agency versus the other agency versus the third agency, and the discussion for 10 years is hardly the point. I think, Dr. Jayadevan, is it not a fact that nobody really knows if you die of pollution? Because you don't die of pollution itself, you die of a heart attack, or you die of ailments which affect other organs in your body. But nobody will ever be able to necessarily pin down that deaths or serious illness which have been caused have been because of this. And because of this medical fact, right, you can't always apportion a death to air pollution. The people will ultimately get away who are responsible for this, and people will forget about this.
Yeah, that's a good point. It is difficult to estimate the true impact of individual, say, gases or other toxic chemicals in terms of long-term outcomes. Specifically, as you said, of how many people get cancer. For example, there are studies from India that show that this public burning of plastic waste can lead to approximately 3 cases of cancer out of 1 crore people. Now, I don't know how they came up with these numbers, but these are published studies. It is not an enormous number, but it is difficult to say if that's an overestimate or underestimate. I would say it's an underestimate because, as I said, how do you prove this? Because 10 years from now or 20 years from now, if somebody gets a disease, how do you prove that it is because of this particular exposure? So that is one limitation that we have right now, which is why I said in the beginning, the long-term outlook is unclear. The faster we get rid of this, the sooner the smoke and the fumes settle down, the less the exposure will be. The cancer risk directly is proportional to how much smoke goes in other words, toxic gases go in, and how long, what's the duration of it. So those are the points, and I think we're looking forward. I think assertive measures have to be taken so it doesn't repeat ever again.
Dr. Krishna, would you be aware of the process where